Hi, my name is Stu Wild, and I work at 360 Neuromuscular Therapy in Greater Boston. At our clinic, we teach neuromuscular therapy and we teach trigger point therapy. I'm here today at Oakworks using the Oakworks ProLux table to demonstrate techniques that are very much a neuromuscular therapy trademark. These are 4 intra-oral techniques to help people that have jaw pain, have ear pain, have tinnitus, and maybe have bruxism. All of these techniques involve muscles of the jaw, and we're going to access them intra-orally. The first of the techniques will be outside the teeth, and we'll slide our fingers within the cheek and outside the teeth to access the masseter. The second of the techniques will be with the jaw deviated across. We'll access the temporalis tendon attachment on the coronoid process of the mandible. The third of the techniques, I'll come around to the other side of the table, and I'll be accessing the lateral pterygoid in its attachment to the sphenoid process as well. And then I'll come back to the same side and finish the last of the techniques. This will be the one and only technique that is inside the jaw, inside the teeth, I should say. And this one will be accessing the medial pterygoid on the medial side of the ramus of the mandible here. What I'm going to do throughout the technique is always know I've used good technique, because my finger will always be in a hook position with a pad facing towards me, whether it be my right index finger or my left index finger. I'll know I'll be using good technique because my pad will always be visible to me. So the first of the techniques I will perform on Katie is to have her open her mouth. I'm going to slide my finger inside the cheek like so, and then I'm going to get her to clench her teeth. She will not bite my finger because I am not within the teeth. So 3 of the techniques are outside the teeth, and the first of them is the masseter. I can do a broad contact of masseter here using the back of my hand and just get a sense of the muscle. And if you could clench once again, please, Katie. Good. And now I have a sense of what is in the muscle. I go looking through for taut bands and dense palpable nodules there within those taut bands. And I'll use a pincer grip palpation for this technique. And then I can work my way successively down through the muscle. Clench again, please. I'm getting good sense of the bulk of the muscle here. And then I'll work my way down to the inferior fibers and do a thorough job searching through masseter for trigger points that fire into the maxillary sinus, into the teeth, into the jaw itself, and some into the brow and frontal bone. Good. So that's the masseter. In order to get the next technique, it's very similar. This muscle, this bone, I should say, is buried within the cheek itself. So I'm going to try and access the hard bony attachment point of temporalis. If you could deviate your jaw across towards me, and then open halfway, good, and deviate a little bit more, lovely. And now if you could just hover your jaw a little bit up and down, that gives me a sense of the coronoid process, the attachment point of temporalis, and then relax. And then I explore the very broad attachment point of the temporalis tendon on the coronoid process. The third of the techniques involves me moving around to the far side of the table. I'm going to change hands, and I'm going to slide my index finger, still with my pad facing towards me. Katie will deviate across to the right-hand side. I'm going to slide my finger in past the rear of the back molars into a pocket there. And what I'll get to find out if I'm in the right position, I'll get Katie to actively protrude and retract, and beautifully that pocket opens up and the muscle presses against my finger pad, and then relax. And then I'll take my finger out. If you can open and close, good. Swinging round to the same side again using my right hand index finger. For this technique, I'm going to get some preparation involved. Katie's going to be instructed to take a deep breath in before the technique happens. The legs I'm going to be bent up, and she's going to lift her feet somewhat off the floor, just an inch or so, and contract her abdominals here and keep her diaphragm from being used for the gag reflex. So this is the one and only technique that is found done within the teeth. So I'm going to get Katie to open her mouth, deviate a little bit, just the lower jaw, and take a deep breath in. I slide my finger down, my index finger down, and access the muscle at the very topmost attachment point. She's breathing out slowly. I'm going to take my finger out and give her a chance to swallow, especially if this is the first time she's had the technique done. And then we'll go back in again and get another sense. Deep breath in if you could. Slowly breathe out. And you can see how far my index finger has to go in to get the technique done. And then I'm going to take my finger out. And where I am for this technique is I'm deep down, and I've got to be so far down that I get my finger pad on the medial pterygoid muscle as it progresses up to the sphenoid bone. Just like to thank Oakworks for allowing us to use their facility, their wonderful facility, and their video filming. It's a pleasure to be here. Thank you.